Here's a patient I want to show you that's 5 weeks post-op, where we performed surgical correction of a bunion deformity on both her right and left foot. It's really amazing how fast people can get back to work. She's already back at work 5 weeks later, and we've done osteotomies on both her right and left foot. On her right foot, she had a fairly significant bunion, and her hallux was drifted laterally. We did an Eischen Revirden and also a percutaneous Aiken on both her right and left foot. You can see this is post-op. She has real good range of motion. Some swelling is still present, but she's already back to work in less than 6 weeks. And you know, through traditional procedures, this would have taken a lot longer. Let me show you the X-ray. Here's her X-ray. She had a moderate bunion deformity with a significant hallux interphalangeal joint deformity here. So her toe drifting laterally. What we did, this is 5 weeks later. You can see our osteotomy is healing both in the metatarsal head and also in the hallux as well. One other thing I want to show you is when we do these procedures, even though we're leaving the lateral cortex intact, we actually are getting plantar flexion of the first ray. You see that the way the talus is angled this way, and the first med is actually plantar flexed. So when we do osteotomies in the metatarsal head and in the hallux, we are getting plantar flexion of the first ray without having to actually go through with the osteotomy. Here's her other foot. This is her left foot. You can see this foot a little bit less bend in the toe, but significant bunion deformity there. And so with her left foot, we did a very similar procedure. Eischen Revirden and Aiken, all these are healing well, and she's basically back at work within just 5 weeks. Here's our patient who has been a friend of ours for years. How much trouble as far as post-op pain was this for you? I mean,
not much at all.
Right.
Not much medication.
Okay.
Was incapacitated for a few days,
right.
really.
Okay.
But after that, it was very tolerable.
Right.
Really didn't even have to take complete medication.
Right, and you're happy back at work, because work is something that most of us can't take a long period of time out. So, one of the advantages that we have with minimally invasive surgery is a much quicker surgical times as far as doing the procedure, and also the patients are back at work a lot sooner with minimally invasive surgery.